So the two parasites we need to consider for dairy cows during the summer is Ostertagia, the stomach worm, and also lungworm. So Ostertagia is picked up from the grass whenever cows are grazing, and it will cause a damage to the lining of the gut wall, to the stomach and to the intestines. That damage reduces the ability of the cow to uptake the nutrients from the grass, and it also causes a decreased feed intake, which then has an effect on reducing milk production. This milk drop can be up to 2 litres per day, and Teagasc figures have shown up to 210 litres per lactation per cow. So to diagnose Ostertagia in your herd, you can use the Glanbia Herd Disease Screening Service, where the bulk milk sample is tested to detect the level of Ostertagia antibodies. If the Ostertagia antibody levels are high, over 0.7, then there will be value in dosing the younger cows. If the antibody level is over 1, it's best to dose the whole herd. The other parasite to consider through the summer months in cows is lungworm, and that's also a roundworm like the Ostertagia, but it affects the lungs instead of the gut. It's also picked up when the cows are grazing, and the way we graze these days, grazing so tight, which is the correct way to graze, we're going to be picking up a lot of these parasites from the grass. The main sign of lungworm in the cows is a cough. It can be mild to severe depending on the level of infection, and that will of course have an effect on the cow's intakes and the level of milk production. It can be a particularly severe milk drop in the immature developing stages of the lungworm, where before there's any cough seen, there's a big milk drop, and we have seen a lot of that in the past couple of months this year. The same treatment that's used for Ostertagia can also be used to control the lungworm. The only problem is that diagnosis of lungworm is not as simple, and you haven't got the same test, so the fecal egg counts won't be very reliable until there's a very advanced stage of disease, and also the same with the bulk milk testing. So when it comes to the diagnosis of lungworm, it's really just listening out for the cough and looking out for the milk drop when the immature worms are doing damage to the lungs, causing that inflammation.